to the inaugural conference of the USC Institute for Integrative Health here at the University of Southern California. Really, the main intention is just to get people together who are excited, enthusiastic about the field of integrative health, people both from the USC community and the general community, so that we can kind of meet, share ideas, share our enthusiasm. Of course, we hope that there will be people who make connections and will develop collaborations going forward from this point on, so that ultimately this conference will serve our overall goal of really bringing integrative health and healing ways to USC medicine and the USC community at large.
The idea about the conference came out as a genesis for all the different departments that are teaching different modalities and different subjects and curriculum on integrative medicine, and they're scattered throughout the entire university, from the School of Medicine to the School of Pharmacy and Botanicals to the School of Music with sound therapy and music therapy. The School of Religion has rolled out a mindfulness program. So we just thought we'd all get together, the different faculty, present ourselves and inform the student community at USC, other communities. So we'd like for the attendees to experience and learn about some of these modalities like traditional Chinese medicine and acupuncture, Tai Chi and yoga and meditation, and even get to experience things like guided imagery, so they can kind of enhance their health and share it with their friends, family, colleagues, and patients.
Our vision essentially at IIH is to create a collaborative model of healthcare, one that really deals with the whole person, which includes all human attributes: body, mind, spirit, culture, social, environment, nature.
So it's healing-oriented medicine. It recognizes the dynamic healing capacity of the human being. And it looks at the whole person, mind, body, and spirit, and pays a lot of attention to lifestyle.
There are 21 different visible ethnic enclaves. So I go around and look for traditional healers. These ethnic enclaves include all the way from Chinatown to Koreatown to Armenian town. They come with thousands of years of tradition. So me and my students, we are going to create a database to find out where they are and how we can reach out. I would like to see the real traditional healers come over and dialogue and interact and share their practice wisdom with our learned people, like our faculty and students.
Everybody in this room who's a health professional got called into this work. You know, most people, when they see someone suffering, actually want to run in the opposite direction. That's sort of normal. You know, you don't want to lean in to suffering. You want to go the other way. And yet somehow we in this room are wired that when we see someone who's struggling, someone who's suffering, we lean in. We want to be of service. We want to be of help. And it infuses our lives with a deep sense of meaning. But it also has a cost. And the cost means that we have to be impeccable in the ways in which we take care of ourselves. It's very exciting to speak to an interprofessional audience. We know the evidence in the literature shows that when doctors and nurses are physically active themselves, they're actually much better at counseling their patients and at motivating their patients to take these actions in their own lives.
This talk is called Harmonizing Rhythm. So we're always talking about being in balance and having harmony. Well, we get out of harmony when we're ill, when we're stressed, when we're under have mental fatigue. And so how can we bring harmony back? Sometimes it's just harmony of music or sound. The mouth starts to open.
Okay, I don't know how many of you saw this, but David was brought to the United States out of the museum in Florence and came to the United States. And we fed him our American diet. Do you feel vital after you eat a meal like this? Or do you feel a little sluggish? And we know that Americans, for the most part, don't eat the recommended amounts of whole grains, vegetables, fruits, dairy, seafood, and we eat way too much fat and added sugars and refined grains. And so we fed David this diet, and 2 years later we sent him home. Doesn't look so good, does he? And experts predict that this may be the first generation whose life expectancy actually gets shorter.
The healing goes way beyond the one-on-one patient care, that we've got to enhance a comprehensive, holistic modality that transforms lives and the planet, which includes lifestyle changes, meditation, mind, body, spirit connection.